I'd like to demonstrate pin and stretch technique for the right side pectoralis minor. So first, to be able to stretch the pectoralis minor, we need to move the scapula away from the rib cage because the pec minor goes from ribs 3 through 5 onto the coracoid process of the scapula. So I have Justin positioned on the table so that his scapula is off the table. Now, because that would make him come very far to the side, I have him a bit diagonal on the table so he's more secure and stable on the table. I can also, Justin, invite you to take your left hand and hold on to the other side of the table, which might make him feel more comfortable on the table. So I have the scapula off the table, and now I need to bring the scapula down toward the floor. In other words, retraction and even some elevation so that we stretch the pec minor. So Justin, let me have your right forearm here. Now, a lot of people do this by keeping the arm straight and pushing down on the client's hand or distal forearm. But then that would stretch out the biceps brachii, and that might stop the stretch from being experienced at the pec minor. So I always like to keep the elbow joint in flexion, and he can rest his forearm against my forearm here. And now I can bring him down into a stretch. So this is a regular stretch for the pec minor. But to make this a pin and stretch, then what I need to do is place a pin somewhere along the length of the pec minor musculature. Now I could use fingertips, thumb tip. They're very specific, but they're also a bit pokey. I could use the heel of my hand, but if it's a female client, I need to keep my hand away from touching breast tissue. The extension at the wrist joint might be a bit uncomfortable. I could also reach in and use something like my elbow or perhaps flat forearm. If reaching in here gets a little bit intrusive for the client's head and face area, I could always invite him to rotate a bit away so that there's a little more room to work here. Now, why would we do pin and stretch? If I do a regular stretch and I pull the coracoid process away from the ribs, then I'm going to place the stretch along the entire pectoralis minor. But let's say that the tight spot in the pec minor is somewhere superior distal toward the coracoid process. And maybe the rest of the pec minor is fairly loose. If I do a regular stretch, then the loose tissue, the hypermobile tissue, will compensate for the taut tissue, and I will not get the stretch experienced at that trigger point or tight spot. Pin and stretch allows us to focus the stretch to one region of the muscle. If I place my pin point here and I bring the scapula down away, the stretch goes along the pec minor until it reaches the pin point, and then the stretch cannot go beyond that. So placing the pin here is like creating a new attachment for the target muscle that we're stretching. The overall point of pin and stretch is to focus the stretch force between the attachment that you're moving and the pinpoint that you place. Some people will do it where they simply start at one attachment, bring the client into the stretch, move the pin a little closer, bring them into the stretch again, bring the pin even closer to the attachment we're moving, and they keep going in successive points along this way. Now, you can certainly do that, but the most efficient way to use pin and stretch is find the tight spot, let's say it's right here, and place the pin directly beyond that tight spot, let's say right there, and this will best focus the stretch force between the attachment we're moving and the pinpoint to catch the tight area that we desire to stretch. So this is pin and stretch for the right side pec minor.